Thank you for the kind introduction. I'm pleased to participate in this event. Let me take you a little back in history. In 1980, we estimate that 2.7 million children under 5 died from diarrhea. In the most recent estimate for 2019, 500,000 children died from diarrhea. Still too high, but a major reduction. What happened in that 40 years to explain the decrease in diarrhea deaths, even as the number of births increased? Of course, there have been improvements in water, sanitation, hygiene, nutrition, poverty, but one intervention, treatment of diarrhea with oral rehydration solution, or ORS, has been especially important. The clinical science showing how ORS resulted in fluid absorption during diarrhea and that it prevented or treated dehydration was in the 1970s. But in the 80s, WHO launched a global program to enable countries to use this life-saving treatment at scale. We did an analysis of the factors that resulted in the decline of diarrhea deaths from 1980 to 2015. During that time, the percentage of children with diarrhea who received ORS increased from 0 to 44%. ORS could explain in that analysis a third of the decline in diarrhea mortality. However, the use of ORS stagnated and still remains around 40%. While ORS has remarkable benefits for reducing deaths because of fluid replacement, it does not shorten the duration of illness, resulting in the use of other treatments such as antibiotics that are not effective and can be harmful. When studies showed that orally administered zinc could reduce the duration and severity of diarrhea given along with ORS, WHO and UNICEF recommended in 2004 that it be given to all children with diarrhea. Unfortunately, the scale up of zinc has generally been very slow, reaching only about 15% of diarrhea episodes now. Even with this limited coverage, we estimated that zinc accounted for about 5% of the diarrhea mortality reduction from 2000 to 2015. Some countries have done much better. For example, Bangladesh scaled up zinc use to 50%, and in our analysis, that accounted for 12% of the mortality reduction in that period. That 500,000 children still die from diarrhea each year is unacceptable, especially because we have the therapies that can reduce these deaths to negligible levels. Starting from a combined coverage now for ORS and zinc of only about 15%, we must accelerate progress. Studies in multiple countries have shown that packaging ORS and zinc together can result in rapid increases in coverage of the combined treatments. Co-packaging can best ensure that health workers provide both treatments and that caretakers receive both when they are available for purchase. With improved availability and promotion of co-packaged ORS and zinc, it should be possible to increase that coverage up to and ultimately exceeding the coverage now for ORS. The addition of co-packaged ORS and zinc to the WHO essential medicines list is a big step forward, and that should encourage countries to adopt the approach and take the necessary actions that can very substantially reduce child mortality. Thank you.